Hello everyone, you're welcome to my YouTube page. This is a page where we will be talking about how to get pregnant and have a baby. My name is Babatunde Kiwale. I'm an obstetrician and a gynecologist. I am also a fertility expert. I am the MD CEO of St. Ives Healthcare Organization. Today, we'll be talking about ovulation problem. So the first question we would ask ourselves is, what is ovulation? Ovulation basically means the release of an egg from the ovary. So what could be the problems with that? There are basically two types of ovulation problem. We have what we call an ovulatory problem. Anovulatory means absent ovulation. We also have what we call oligovulation. Oligovulation means that the ovulation comes infrequently. Now, ovulation problem accounts for about 30% of all female infertility. But the good news is, in about 70% of women who have ovulation problem, they can be easily treated. Now, before I go on to the symptoms and the causes of ovulation problem, it will be very important to know how ovulation occurs and what happens during the menstrual cycle. At the beginning of a woman's menstrual cycle, there are some hormones that are produced and released from the base of the brain. There is a particular organ called the pituitary gland. It sits at the base of the brain. It produces three hormones. The names of the hormones are LH, FSH, and prolactin. On the day the period starts, the pituitary starts to produce the FSH. FSH means follicle stimulating hormone. And what that hormone does is, it starts stimulating the follicle on the ovary so that they can start getting bigger. Now, throughout that process, it takes like 2 weeks for the follicles to start growing and growing and growing. And once the follicle starts growing on the ovary, they will start producing a particular hormone called estrogen. Now, that estrogen, when it gets to a particular level, roughly about 2 weeks, it will trigger another hormone in the pituitary, and that hormone is called LH, that is luteinizing hormone. It is that hormone that makes the ovary to release the egg on the ovary. And the process of releasing that egg is called ovulation. Once ovulation has occurred, the cyst or the follicle from where the egg is released forms an organ called the corpus luteum. Now, what that corpus luteum does is it produces progesterone. So the function of the estrogen and the progesterone that are released on the ovary is to wait and see whether the egg that has been released will result in pregnancy. If it does, those two hormones will maintain the pregnancy. If nothing happens, after a few days, like 10 to 12 days, those two hormones, especially the progesterone, will act on the inside of the womb and make it to shed, bringing about menstruation. And that process starts all over again. The pituitary produces the hormone. If nothing happens, if pregnancy does not occur, the endometrium sheds the blood away. Now, how do you know whether your period is irregular? The normal menstrual cycle is usually between 21 days and 36 days. On the average, for most women, they see their period every 28 days. A woman has a period or a menstrual cycle that is less than 21 days. that menstrual cycle cannot support ovulation. So we know straight away that most likely she's not ovulating. And if anyone has any menstrual cycle above 35 days, we know again that most likely they are not ovulating. Now the other thing is, even if you have your menstrual cycle between those ranges, but they keep changing month to month, that is, for example, let's say this month you have a 28-day cycle, the following month you have a 21-day cycle, and the other month you have a 33-day cycle. Despite the fact that they are within the range, they are irregular. Now the other question people ask is, how can ovulatory problem cause infertility? The first thing is, for a woman to get pregnant every month, the chances of pregnancy for a woman in a month is just 25%. What I mean by that is, if there is a couple that decides they were going to make love throughout the whole month, and the woman knows her fertile period and she knows her ovulation period, the chances that she will get pregnant in that 1 month is just 25%. So now imagine someone who is not ovulating. That means, or who has an absent ovulation. That means pregnancy most likely will not occur. Or in someone who has irregular menstruation, that means the chances of getting pregnant will be very infrequent. Now, when we talk about irregular ovulation, it could be anything from 6 weeks to sometimes 6 months. So what causes ovulatory problem in a young woman or a woman of reproductive age? There are quite a lot of things, but one of the commonest causes is a disease process called polycystic ovarian syndrome. Now, what happens in polycystic ovarian syndrome is, it is an endocrine problem on the ovary that happens in such a way that the woman is producing excessive male hormone. And what male hormone does is, it disrupts ovulation. Another reason why a woman could have ovulatory problem is obesity. Any woman whose body mass index is above 30 is prone to ovulatory problem. Any woman who is too thin or who is anorexic and whose body mass index is less than 18 is prone also to ovulatory problem. There are some women that suffer from what we call premature menopause. That is, they achieve menopause before the normal age they are supposed to achieve it. Normal menopause occurs around the age of 50 to 51. When women who have premature menopause, below the age of 40, their period stops and they don't produce eggs again. We know that the best time for a woman to be reproductive or to be very fertile is between the ages of 20 to 29. For most women, as they grow older, the quality and the quantity of their eggs starts to decrease. From age 35, it starts decreasing at a very fast rate. Other things that will cause ovulation problems are things like thyroid problem. There are some women that have what we call hyperthyroidism, and there are also some that have what we call hypothyroidism. There's a disease process also called unruptured follicular syndrome. What happens in unruptured follicular syndrome is the follicle grows on the ovary as if it's going to rupture and result in ovulation. But unfortunately, it just keeps growing and growing, but rupture does not occur. So if a woman comes and says she has ovulatory problem, how do you diagnose it? The best way to diagnose first is to take a very good history from the woman. And one of the things that she would say in her history is that her period are not regular or they are absent. That's the first thing. Whenever any woman says, my period is prolonged, I don't see my period, I see it every 6 weeks or every 8 weeks, or I have not seen my period for like 3 months, then the alarm bell should ring that she probably has an ovulatory problem. There are blood investigations that can be used as well. There is a particular hormone called progesterone. If you remember, I said that particular hormone, immediately ovulation occurs, the corpus luteum on the ovary, where the egg is released from, starts producing progesterone. So once ovulation occurs, that progesterone starts to rise in the blood of a woman. So if you take the progesterone level of a woman, especially the 21 progesterone level, and it is low, then it shows that the woman has not ovulated. Another investigation that can be done is ultrasound scan, a pelvic ultrasound scan. A pelvic ultrasound scan will give you some information. It will help you check the ovary to see whether it is polycystic. It can also be used to track ovulation, especially in women who don't know when they are ovulating. But the gold standard of all the investigation is what we call hormone analysis. What that means is we check all the hormones of the woman. Now, the hormones we are going to check are basically fourfold. We have what we call follicle stimulating hormone that I mentioned earlier, that is produced from the pituitary, the LH, the prolactin, the estrogen, and the progesterone. Those 5 hormones, once you measure them, it will give you a very definitive clue why there is ovulation problem. 5 different things can happen from the hormone analysis. The first thing you can notice is the FSH, the LH, and the prolactin, and every hormone looks normal. If the FSH and the LH are reduced, because these are hormones that are produced in the pituitary, if they are reduced, it will mean that the pituitary gland has some problem. That's number 2. The fourth thing is, if you check the LH over the FSH ratio, normally it should be 1. If for any reason it is more than 2, then it could be suggestive of polycystic ovarian syndrome. So you might have to do some other tests to confirm whether it is polycystic ovarian syndrome. Sometimes the prolactin is raised. When the prolactin is raised, we call it hyperprolactinemia. In women who have raised prolactin, what happens is the high prolactin will block ovulation, so they will become anovulatory. And sometimes they might be noticing some milk from their breast, which will again suggest that their prolactin level is high. Now, after you've diagnosed that a woman has ovulatory problem, what is the treatment? From all we have said, you will see that there are different things that will be causing ovulatory problem. So the treatment has to be individualized. Depending on what you have detected to be causing the ovulatory problem, that is where you direct the treatment. If the problem is polycystic ovarian syndrome, then all you need to do is ask the woman, is she trying to get pregnant or is she not trying to get pregnant? If she's not trying to get pregnant, just the common birth control pill would regularize the irregular period for her. If she's trying to get pregnant, there are some things that can be done. Things like lifestyle changes. If she's obese, she will need to lose weight. She will need to change her diet. She will need to be exercising. She will need to be on some form of ovulation program. And there is another particular type of probe that has been found to be very useful in polycystic ovarian syndrome called metformin. So, like I said, depending on what the cause is, that is what you face the treatment towards. So it's an individualized thing. If the problem is that of obesity, just losing weight, just losing 10% of a woman's weight will restore her period and may restore her ovulation. If the problem is a woman being too thin or her body mass index is less than 18, then she needs to gain weight. If it's a thyroid problem, the appropriate treatments are there. But once a diagnosis of ovulatory problem has been made, it is important that you see your gynecologist. And if you are trying to get pregnant, preferably to see your fertility expert. And finally, there are some of my clients that ask, how do I know when my fertile period is? Or how do I know when I am ovulating? If you have a regular cycle, it's quite easy. What happens is, from the day you ovulate till the day you see your next period is a constant. There's always 14 days between the day you ovulate and the day your next period comes. So if you're a 28-day cycle person, just remove 14. That means you normally ovulate on your day 14. If you're a 29-day cycle person, remove 14. You ovulate on your day 15. And if you're a 30-day cycle person, you ovulate on your day 16. Now that rule applies for people whose period or cycle are regular. We've already spoken about what regular cycle is. Ovulation day is different from fertile day. The day you ovulate is the day the egg is released. Your fertile day could be anything between a day before that day or a day after. Don't forget, once you release the egg, it can survive for 24 hours, whereas the sperm can survive for up to 72 hours. Thank you for watching. I just wrote a book called How to Get Pregnant and Have a Baby. It's available on Amazon and it's also available at stives.healthcare.com. That's our website. Don't forget to subscribe to my YouTube page and please like, comment and share. I will see you in the next episode very soon.